Your baby has only one primary way to communicate. Crying is a common way for your baby to communicate what they need. So this video is all about crying in babies and infants. We will be discussing why does your baby keep crying, what to do if your baby is crying excessively, common types of baby cry, when you should be concerned about your baby's excessive crying. As new parents, we may be expecting our baby to eat, sleep, and be happy, but all babies cry because babies communicate their needs by crying, and until this need is met, baby will cry excessively. Knowing the reason why your baby is crying is very important. The only way that your baby can communicate their needs to you, so that way you can respond to their needs. Does your baby vomit after a feed and then begins to cry? Does burping help your baby to feel better? So it may be that your baby is suffering from acid reflux, which is quite common in babies, especially babies that are born too early. Milk, some of the stomach contents, it leaks back into your baby's throat, cause a burning sensation for your baby, and that's when your baby will cry out, the hunger cry. It's perfectly normal for an infant to cry when they're hungry, and this may be another reason why your baby is crying. So when you hear the hunger cry, it probably is a sign that your baby is very, very hungry. It is also important to note that crying is usually a late sign of hunger in babies. The baby is saying, "Feed me." By the time your baby is crying, they'll likely already be very hungry and upset. So before they cry, normally signal that they need a feed with several hunger clues. So moving their fist to their mouth, turning their head, looking for the breast, on their hands, we call lip smacking. You can look out for these hunger clues, because once your baby is very hungry, they won't stop crying until they are fed. They need feeding right now. They can't wait. The other type of cry that you can look out for, a very irritating cry that you've never heard your baby cry like this before, because your baby might be in pain when they are crying. Upset, in pain, that the cry is significantly stronger and much more intense, causing your baby to go tense, pull up his legs and cry out or scream. This may mean that your baby is in pain. That's the only way that your baby might be communicating this pain to you. So you can look out for this. The colic cry. Colic crying is louder. So if your baby has colic, have long periods of inconsolable crying. Some parents even explain a high-pitched cry, high-intensity cry. So some babies can cry for hours. So researchers have yet to find out the true cause of colic. However, if you are breastfeeding and you are excessively stressed, you are excessively tired, baby is feeling excessively windy, that may influence whether your baby will be suffering from colic or not. Colic is more common in the evening time due to trapped wind in the intestine. Babies usually suffer from colic between 3 and 12 weeks old. Colic can be very, very painful for babies and very, very distressing for you. So if you feel that your baby's cry is a bit different from normal, it may be that your baby is unwell. Your baby might be suffering from some health condition or ill health, and see that your baby is crying excessively and it's really hard to console them. Crying is one way, an important way that your baby is using to communicate. So unfortunately, if your baby has pain cry, they are not happy unless they are crying. No matter what you do, what you try, it does not seem to calm your baby, or it only calms your baby for a short time. High intensity cry. So these babies, when they are in pain, they cry a lot. This is because your baby is trying to communicate to you that they are hurting. So it may be an indication that something may be seriously wrong with your baby, or it could just be a minor illness. But that's the time that you need to seek medical advice. It may not be something serious, but it's best to check this out with your doctor. So your doctor will probably examine your baby and rule out serious medical condition. It will help you to feel a bit better, also to feel reassured. It's also normal for your baby to maybe have a fussy period in the evening. Your baby may be crying because your baby is finding it very hard to fall asleep. According to the experts, crying is a way of baby discomfort when feelings, exhaustion, and with excessive tiredness starts to kick in. Know that many babies have issues getting to sleep, sometimes cry themselves to sleep. If your baby has had a very long day, a very stressful day, seems overstimulated, overtired, and they find it very hard to settle at night, and their only means of communicating this to you is excessive crying. So if you feel that night times are becoming especially stressful for you, then you may think about asking your family or friends to give you a break, to take the baby so you can have a short break. If your baby is suffering from acid reflux, burping your baby correctly does help. Try and wean your baby properly. So baby colic usually gets better, or it disappears altogether by the time your baby is 4 months old. You may want to try giving your baby anti-colic medicine that you can purchase. They make your baby feel better. Feed your baby before they actually get to the hunger cry stage. Babies occasionally cry for no common reason. Sometimes the cause of your baby's crying is not clear. Sometimes the reason is not clear to you, even as a parent. You don't really understand why your baby is crying. So this can be very stressful. It's equally important to learn when you yourself need a break. So it takes time to learn the different cries, and it may take some time for you to learn that your baby is trying to communicate to you. So you know your baby the best. Trust your instincts. You are feeling that you are unable to cope with your baby's excessive crying. You may find it helpful to ask your friends or your family to look after baby while you take a much deserved break. As your baby gets older, then the crying gets less and less as your baby learns to use other gestures, other clues to express their needs. So the crying will definitely get better as your baby gets older. If you get any value at all from this video, don't forget to like, subscribe, give me a thumbs up, and help me to reach 500 subscribers. Until next time, goodbye, take care of yourself and each other.